All right, here we go. Hello, everyone, and thank you for watching this program on DCPTMD acupuncture integration. There's no audio taping or video taping allowed, and any unauthorized reproduction, dispensing, or forwarding of this target coding presentation is illegal. The information in this webinar is for educational purposes. It's not intended to be legal advice. We don't provide legal services. Target coding does not engage in providing legal services. Every attempt has been made to make certain the information in this presentation is 100% accurate, however, not guaranteed. A little bit about myself before we get going. My name is Dr. Marty Kotler. I'm a chiropractor. I practiced for many years, 16 years to be exact. My first 12 years in practice was chiro only, and then I decided, I want to get involved with the integration. I want to bring on medical doctors, physical therapists, acupuncturists, nutrition, do all kinds of insurance-based services and a whole bunch of cash-based services. So I did that for 4 years, and that led me into writing articles for chiropractic economics on how to bill and code in a multi-specialty environment. And I still write articles to this day for Chiropractic Economics magazine. I'm also a certified professional compliance officer, a certified billing and coding specialist, and I take I feel like I'm a little bit of a little unique. I take an unconventional approach because, think about it, most chiropractors are not certified coders. Most certified coders are not chiropractors. So I blend my 16 years of clinical experience with my 12 years now of coding and billing expertise, and I can help my clients maximize reimbursement, make sure they're not leaving any money on the table. You know, some people say, hey, Marty Kotler, he's the insurance guy. No, I don't consider myself the insurance guy because to me it doesn't matter if you're all insurance or all cash. We just want to make sure you're complying with all the laws and rules in your state. If you're billing and coding, yes, we want you to do that correctly. If you're cash practice, we want to make sure you're not violating any dual fees or violating any anti-kickback statutes. So we just want to help doctors maximize reimbursement through proper billing and coding, and we want to make sure you're not leaving any money on the table. I've written many training manuals on billing and coding, not only for chiropractors, but for physical therapists and acupuncturists. I continue to write articles for many of the major chiropractic journals and magazines throughout our profession, and I'm a guest speaker at many state association conventions nationwide. By the way, if you are part of a good quality state association, they're always looking for speakers. If you would like to enter my name into the speaking category at your upcoming convention, let me know. My calendar is full for the next year, so we'd have to go a year out, and I usually can get a sponsor, which makes the state associations very happy, so they don't have to pay any money for me to come out and speak. Let me know if you're interested. All right, let's begin. There are pros and cons to practice integration. It's not all pros. I could tell you that. See, another thing that I find is a little unique about my approach when it comes to DCPTMD integration. It doesn't matter to me if you do it or not. I can help you whether you're chiro only or an integrated practice. There are some companies out there that all they do is all they do is practice integration. So if you don't want to bring on an MD or PT or other services, they really can't help you. So they may paint a rosy picture, too rosy. So to me, again, it doesn't matter if you do this or not. So I'm going to share with you some of the negatives. Now, overall, I think it's a great thing to do. Out of every 10 doctors that contact me that tell me they want to do this, I'm on board with 8 out of 10. 2, I tell them, no, you do not qualify, do not do it. So in my practice, when I went from chiro to integration, one of the best things for me was I was able to co-treat patients with other healthcare professionals right in my office. That's one of the main things I enjoyed. Up until that point, if I had a question about what was going on with the patient, I had to call one of my friends or colleagues, or if I had a question about an MRI or an X-ray, I had to, go and drive down to the radiology center and discuss it with the radiologist. All of that went away when I started bringing other healthcare professionals. It was nice. It added another clinical approach, added more services, so many more marketing opportunities, so many more new patients will want to come in because of your practice integration. The negatives, you're going to need more room. It's going to be a lot more expensive to run this. If, it doesn't have to be, but if you just say what a lot of doctors say, Marty, I want to bring on a nurse practitioner to work in my practice. Okay, a nurse practitioner, average salary is about $80,000 to $100,000. Do you have that? Some docs don't have that money, so it doesn't go past that. You may have to add more work. It will add more work to your existing staff. Again, I'm going to share a lot of stories with you, which we do surveys at my seminars, and that's one of the things that people enjoy about my seminars a lot, is that I'm just going to share. I have so much experience with this. I'm just sharing things with you. When I brought on more doctors and nurses and acupuncturists, most of my administrative staff members, they were okay with it, but some quit. They liked me. I had one staff member go, Dr. Kotler, I like the way you're expanding your practice. I've been working with you for many years when you were just a chiropractor, and now that you have all these other healthcare professionals, I don't like the environment. I don't like, being told what to do by other, doctors and physical therapists. So I quit. So that could happen. Turnover could be stressful. But one of the things, if we have a lot of people listening to this presentation, and some of you are already established in an integrated practice, and many of you I know are thinking about this. You're not sure. You're doing your homework, which is a good thing. I jumped into it, and I lost a lot of money because I just jumped into it. I didn't think about it. If I had to do it all over again, I would definitely do things differently, like a lot of things in life. But you should think about the services you want to provide. What is your ideal practice setting? When I went from chiro only to integrated, my ideal practice setting was doing a lot of things that have nothing to do with musculoskeletal pain. Most chiropractors, when they go into practice integration, where they bring on other healthcare professionals, they stay in the musculoskeletal field, which is okay. But you might not want to do that. You might want to, I have some doctors that I work with, when they integrated their chiropractic practice into multi-specialty, they went right into Botox injections, had nothing to do with, back pain. But most transition to pain management type services. So let's talk a little bit about the setup. The following corporate structure information is for educational purposes. It's not intended to be legal advice. We don't provide legal services. Regardless of your corporate structure, you should contact an attorney prior to seeing patients in your practice. Even if you're an existing integrated practice, once a year, you should get together with your attorney and your accountant and make sure you're doing things right. One of the biggest problems I see in integrated practices is the right hand doesn't know what the left hand is doing, and there's so much confusion, and things are being done improperly, and then it leads to improper billing and coding. For example, the nurse practitioner sees the patient, comes up with a diagnosis, and then the patient also sees the chiropractor, and then the chiropractor's information contradicts what the nurse practitioner is recommending. That's a big problem, and that can cause audits and refund of money. So you basically have three choices when it comes to an integrated practice. Employer, employee. So let's say the chiropractor is the employer, and now you're going to hire and employ staff members. Who can you do that? We'll get to that in a second. But if you're the employer, you're gonna, employer does all the billing under the employer's tax ID, and the employer pays the DCs and PTs and NPs their salary. Employer receives all the gross revenues less the MD, DC, PT, nurse practitioner salaries attributable to the services. A comprehensive employment agreement should be set up. You need an attorney for that. See, some of my integrated practice clients, they're doing okay. They're not doing amazing. So I have some making $100,000 a year, and I have some, my biggest integrated practice is making $12 million a year. So there's a wide range here, and there's a lot of different ways in which things can get set up. Make sure you have a good quality attorney that knows how to set things up. One horror story, a client of mine, he's got an integrated practice. He's paying his MD a salary, thinks everything's going well. Well, come to find out, because of me, I told him, in your state, you're not allowed to employ an MD. Certain states allow it, certain states don't. These are the things you need to check into. So this doctor was paying a medical doctor a salary. Medical doctors seeing patients, they're billing insurance, they're getting paid in his state. He's not allowed to employ MDs. So I want to make sure who can provide services, which is coming up, and is it allowable in your state as to who you can employ. Next, a partnership. Yes, like in New Jersey, for example, New Jersey. I have a lot of clients in New Jersey. Can a chiropractor employ an MD? No, they must become partners. Can the MD own the whole corporation? Can the chiropractor own the entire corporation? Well, it has to be a shared corporation. This is more legal stuff. In the state of New York, let's say, chiropractors cannot employ MDs. They cannot employ PTs. They can partner with a PT. So you have a lot of options. PC, PLLC, check with your accountant. You see, a chiropractic practice could be pretty straightforward and simple. Once you start bringing on other healthcare professionals, employing healthcare professionals, opening up other corporations because of this integrated practice, now you need professional help. You need a good quality attorney. You need an accountant that knows how to set up the corporations and file the taxes for all these corporations. So a chiropractic practice only could be very profitable and a wonderful thing, but it's pretty straightforward. It's pretty simple. One tax ID, chiropractic services. Once you get into multi-specialty, it can get very complicated. It could be simple too, but it can be very complicated because of all the money that's going to be coming in. A lot more money comes in integrated practices. So now you could have a partnership, and then you could rent space. If, I have some clients, they say, Dr. Kotler, I want to do this, but, I found a PT, and I want to have the PT, work with me. But I don't know if I want to marry the PT right away. Maybe we'll just date for a while. I'm going to have the PT rent space from me for a while. So you could see how that goes. So, let's say you have a PT renting space, the PT should do his or her own billing under his or her own tax ID number. The PT pays you rent. It should be fair market value. If your rent for your location is $5,000 a month and the PT is paying you $15,000 a month rent for one room, you see how that could look weird. Now, who can provide all these different services? Well, you have qualified healthcare professionals like MDs and chiros and acupuncturists, and then you have clinical staff. QHPs can bill insurance, clinical staff cannot. Now, sometimes, I hear this. Well, why would a physical therapist want to work for me, Dr. Kotler? So you're a chiropractor and you call a medical doctor and say, hey, would you like to work for me? Medical doctor might say, why would I want to work for a chiropractor? Well, there's a lot of reasons why medical doctors would want to work for chiropractors, and physical therapists want to work for chiropractors, and nurse practitioners will want to work for chiropractors, and acupuncturists. It's because we can supply them with a job, and we could supply them with a wonderful working atmosphere. One medical doctor wanted to work for me. He was overqualified, but he wanted to work for me. And I asked him, because he was the chief of internal medicine of the local hospital, and he responded to my ad. And he came in, and I asked him, I said, why do you want to work for me? It seems weird. He said, Dr. Kotler, I want to get out of the hospital setting. I just want to work from 9 to 5. I don't want to be on call. I want to make my life simpler. he wanted $250,000. I wasn't prepared to pay that salary, but there's all different reasons. They might not want to run their own business anymore. Maybe they only want to work part-time. Maybe they don't want, like I said, they don't want to be in a hospital setting. Maybe it's a new physical therapist, just graduated PT school that wants experience and learning from a seasoned practitioner. You know, you employ somebody, they get what? A guaranteed weekly or bi-weekly income. Give them their responsibilities. Once you start interviewing them, let them know right up front, even on the phone call, let them know you're going to be responsible for evaluating and planning and directing services. You're going to be coordinating and delegating and supervising responsibilities. You're going to need to communicate and assist in resolving problems, participate in training. You're going to need to know how to administer modalities, therapeutic procedures, do joint injections, trigger point injections, orthotics. Let them know. Now, you may want to get your MDs and NPs in network. You know, pros and cons to being in, pros and cons to being out. This can slow down things. This is where you bring on an MD. You want to start seeing patients. Oh, you want this MD in network? It could take a couple of months. So what do? So you want to get your NPI numbers. You want to get your PTAN numbers. You want to contact the plans if you're going to go in network. Maybe you want to be out of network with some of these services. You know, there's, again, pros and cons to being in, pros and cons to being out. I'm not telling you to join plans. I'm not telling you to drop out of any plans. It's a business decision you have to make. If you're not sure, my recommendation is get in network. This is where it can get confusing, and I could probably spend another hour just on this part, because that's what we do when we train our clients, when we get to the credentialing. You know, this is an important part of practice for some doctors, but if you're not sure, I say get in network. If the medical doctor you're about to hire is already in all the plans, and now you bring the medical doctor into your network, there might not be out-of-network benefits. So this is a very important part if you're going to go in network. All right, so now let's go through a little patient flow. Brand new patient comes in. They have to fill out forms. Make sure you get all the forms filled out. If the patient is coming in for medical services, for allergies or something, that's a different form than a plain old back pain. Get good quality health history questionnaire. We have terrific forms. If you're looking for really good forms, especially for an integrated practice, we have a packet of forms. I've created about 500 forms over the last 12 years. I've taken my greatest hits, 75 of my best forms, and I put together in a packet, and it's available for sale. And it includes a lot of PT and physical therapy forms and medical forms and acupuncture forms. So you want to make sure you're getting all the forms out of the way, HIPAA forms. Make sure every new patient signs HIPAA forms. I'm going to talk a little bit about HIPAA later. A little bit more about patient flow. Who do you want the patient to see first? This could be challenging too. I only have, a few more minutes here, but just this, the patient flow. A brand new patient calls, hi, I want to come in. The medical doctor's there? Great. What happens if the medical doctor's not there? Can the chiropractor see the patient? These are a lot of the questions. Can my staff do the intake? Can the nurse practitioner begin the care? What happens if the nurse practitioner is not there and you just have a PTA? Can the PTA start doing the history? So who can see the patient? Who's going to be in charge? Who's going to be the quarterback? These are the things you need to think about. And let's go through some of the main services that are rendered. Physical therapy services, sure. You're going to start off with the PT evals, right? There are 3 physical therapy evaluation codes. And they're different levels. There used to be one. Many years ago, 97001 there was one physical therapy exam or evaluation code. A couple of years ago, I think 3 years ago, PT's got 3 separate codes. So one The 97161 is considered a low complexity decision-making code. 62 is moderate, 63 is high, and you have to meet certain factors. For example, 97162, the one right in the middle, you have to meet 1 to 2 personal factors. You have to address 3 or more elements in the exam. The clinical presentation must be evolving. And then there's a re-exam code, 97164. That replaced, this replaced 97002. There's still only one re-eval code for PTs. What do we get as chiropractors and medical doctors? We get 10 E&M codes, right? 5 new and 5 established patient codes. Modalities, yeah. Supervised modalities, the application of a modality that does not require one-on-one patient contact. These are not time-based, 1 or more areas. The top 3 are the most common. And then we have constant attendance modalities. This is the application of a modality that does require one-on-one patient contact. Application of a modality, 1 or more areas, each 15 minutes. So these are timed codes. So make sure you get at least 8 minutes. If you're doing any of these, I could tell you 97035, ultrasound, that's the most common constant attendance modality code. In second place, I'd say 97032. Any questions about these, send them in. And then we have therapeutic procedures. Now things go to a whole nother level. This is the manner of effecting change through the application of clinical skills. See, with modalities, the machine is doing the work. You set a patient up on traction, the traction device is doing the work. You're not doing anything. You put stim pads on a patient, you're not doing the work. The machine is doing the work. When it comes to therapeutic procedures, the patient is doing the work. Modalities is passive. Therapeutic procedures is active. 97110, therapeutic exercises, that's an active procedure. The patient has to be doing the work. Balls, bands, tubes, weights. If you're just stretching a patient, that's not an active procedure. That's a passive procedure. That's massage. That's manual therapy. That's an adjustment. An adjustment is passive. 110, 112, these are active procedures. Patient needs to be doing the work. Massage is still good. Medicare pays physical therapists for massage. That code still is valid, 97124. Actually, Medicare, all the codes you see on your screen right now, Medicare pays for all of them. Some of you might be going, what, Dr. Kotler? I'm a chiropractor. Medicare doesn't pay for any of these. You're right. Medicare does not pay chiropractors for any of the codes you see on your screen. But if you were a PT, they're payable. I could tell you, many of my clients, they become DCPT. They only bring on PT specifically for Medicare. In certain parts of the country, I have clients that are bringing in a lot of Medicare patients because Medicare pays for physical therapy services. And the cap was lifted a couple of years ago. So $2,040 worth of service for Medicare, then you have to start using the KX modifier. Another very common service in a multi-specialty practice is acupuncture. There are 4 acupuncture codes, 97810, which is acupuncture without electrical stim for the initial 15 minutes. And then you have 97811, which is also acupuncture without electrical stim for an additional 15 minutes. And then you have 97813, which is acupuncture with stim, initial 15 minutes, and 97814, which is acupuncture with electrical stim, an additional 15 minutes. Acupuncture is based on 15 minutes. You have to be with the patient 15 minutes as an acupuncturist. Acupuncturists do not have acupuncture assistants that can do this. You can't have other staff members. Your acupuncturist needs to be with the patient for 15 minutes. There's no 8 to 22 minute per unit range. This all, there are certain things that I'm going to bring up in this presentation where I know many of you are going to go, what? I've never heard that. Nobody's ever told me that. Yeah, check into it. If I tell you something and you go, how come my coding expert never told me that? How come I go to my annual seminar convention, my annual state association conventions every year. I've never heard that. So if I tell you something that you've never heard, what you should do is investigate it, Google it, talk to your friends. So I'm telling you, with acupuncture, the acupuncturist needs to be with the patient for 15 minutes, in the room for 15 minutes. Most of the time, you'll hear, well, many of you were thinking, what? The acupuncturist in my practice goes into the room, spends about 5 or 6 minutes putting the needles in, and then the acupuncturist leaves, walks out of the room, comes back 10, 15 minutes later and takes the needles out. That's not appropriate. So there's also a HIPAA code for acupuncture. It's S8930. That's actually auricular acupuncture. Verify coverage prior to billing. So acupuncture codes include pre-service, which includes greeting the patient. You can get your 15 minutes out of, you're greeting the patient, you're positioning the patient, you're inserting the needles, you're charting the instructions, you're discussing the previous visit results with the patient, you're examining the tongue, the pulse, the skin, the ears, maybe you're washing hands, disposing of the needles, counseling and coordinating care. So that's how you get to your 15 minutes. Another common service in multi-specialty practice is trigger point injections. Trigger points, that's that little focal area of spasm and inflammation, oftentimes in the upper trapezius, the rhomboid muscles. Could even have trigger points in the lower back, or less commonly in the extremities. There were 4 codes: 20550, 551, 552, and 553. 553 is pretty common. That's multiple trigger points. In my practice, we didn't inject patients. We did trigger point injections, but we used homeopathic remedies. We didn't use any type of medications for any of our services. We were a true holistic integrated practice. We didn't prescribe medication. Everything was vitamins, minerals, homeopathy, herbs. It's okay if I have many clients where the medical doctor is seeing patients for diabetes and, refilling patients' thyroid medication. As long as you are doing things within your scope of practice and you're helping patients, I don't care what you do. It doesn't matter to me as long as it's helping the patient. Okay, next. Joint injections, very common in a multi-specialty practice. There are small joints, like in your fingers and toes, and then there are medium-sized joints, like the wrist, elbow, and ankle, and then there are the large joints, like the hip and the shoulder and the knee. And there are different codes for the small joints. It's 20600. That's without ultrasound guidance, and 04 with guidance. 05 in the medium joints without ultrasound guidance, and 20606 with guidance. And the most common, into the knee, just to cut to the chase, the most common joint injection is 20610, which is a knee injection without ultrasound, and 11 with ultrasound. Don't bill 76942 separately. Those days are over. Now, there are other guidance devices you could use, like fluoroscopy and CT and MRI. So fluoroscopy guidance is 77002, CT is 12, and MRI is 21. Very good. Pays pretty well. Most of the doctors that I work with that integrate from chiro to bringing on medical, the nurse practitioner gets trained, is doing the joint injections, helps a lot of people, very profitable. And you want to get into diagnostic testing, that's great. NCVs, it's changed over the years. Used to pay a lot better, but still available, the 959 codes. And then you have needle EMG. Please do not bill needle EMG codes for surface EMG. I see that every once in a while. Doctors like, yeah, I'm getting paid for surface EMG. I go, really? How is that possible? Nobody pays for surface EMG. Now, there's a surface EMG HIPAA code, but nobody pays for surface EMG. So when a A doc says, yeah, we do surface EMG, we get paid. I go, send me the EOB. Let me see, what are you doing? And they're using needle EMG codes like 95860 or 95864. And I tell the doctor to stop that immediately. Nutrition, yeah, nutrition is huge. Nutrition is a very big part of a lot of integrated practices. Make sure you got it all figured out. There are 3 nutrition codes, which if you're a healthcare, a doctor or a nurse practitioner, you shouldn't be using these. If you're a registered dietitian or a certified clinical nutritionist, then you could use these codes. They don't pay that well, but there are nutrition therapy codes. You should see them on your screen. Here's a common question we get. How do I document for going over lab work, doing nutritional consultations, and selling vitamins? Are these services and products covered by insurance? By the way, those of you listening to this presentation, you should, if you don't get our monthly newsletter, sign up. Go to targetcoding.com, get in our monthly newsletter. Just about every month we send out a little coding newsletter with a little pearl, a little tip. So there's usually a little Q&A section in our newsletter. So this was taken from one of my recent newsletters. How do I bill for going over lab work, nutritional consultations, selling vitamins? Well, going over lab work could be considered counseling and coordinating care, where time becomes the key component. So if you're going to do that, make sure it's face-to-face. Document what you told the patient. So, for example, if you spend 15 minutes with an established patient and more than half that time was counseling, coordinating care, you could use 99213. Next, there's a lot of other services in multi-specialty practices, like stem cell. I mean, wow, how popular is stem cell? Look out, there's going to be a stem cell therapy center on every corner in our country. Everywhere I go, there's a stem cell therapy center. Look out, coming soon to your neighborhood will be a stem cell therapy center. What's the deal? What's the hype? What's going on? Overall, my evaluation of it is very good. I've checked into it. Overall, I like it. There's definitely some negatives. If you want to set up a free 15-minute consultation with me personally about any of the things we're discussing, feel free to email Amy at targetcoding.com, AMY at targetcoding.com. Say, hey, Amy, I'd like to set up a free 15-minute consult with Dr. Kotler about whatever. Stem cell, PT, integration, not integrate, how to find doctors. That's a common question. And this is what we train our doctors, this is a common situation. Marty, I'm thinking about integrating my practice, and, there's a medical doctor, an orthopedist that, when I go to the gym, I always see this guy, and we always talk about working together, but I don't know how to structure the deal. I don't know what to say. I don't know what to ask. He doesn't know. I don't think he knows what to ask. So how do I start this whole thing? So that could be a little intimidating. But, when you do this a lot, we can share with you how to get those relationships started. Stem cell, great. Platelet-rich plasma, also very common. Prolotherapy, hormone injections, biofeedback, hyperbaric oxygen therapy. There's actual code for that. But most of these are cash-based services. Do you want to get involved with these? These are all terrific. Now, also in a integrated practice, when there could be multiple corporations, be careful with the Stark and anti-kickback. Now, I'm not a lawyer. I've said that many times. But I'm going to talk a little bit about this Stark law. If you have multiple tax IDs and you own or have a partial ownership in more than one, and you're referring patients back and forth, speak to an attorney. Make sure you're not violating the Stark law. Next, anti-kickback. If you're getting paid for referrals, careful. If you're waiving copays and deductibles and coinsurance, you could be accused of violating the False Claims Act and the anti-kickback statute. Careful about that. These are the things that become amplified in MD, DC, PT, ACU practices. Again, just a chiropractic practice is wonderful. It's terrific. 80% of my clients are chiro only. It's simple. It's wonderful. It's profitable. I have my biggest chiro client makes $25 million a year just on chiropractic services. Has 14 locations. When you get into MD, DC, PT, acupuncture, it just becomes more complicated. There's more lawyers that you'll need. There's more advice, which is fine. The bigger the game, the more money, that's fine. You just got to be prepared. It's not for everybody. Now, you want to do, you want to offer a discount, so you want to have a special going. Or you want to, let's say your normal fee is $100 a visit, and now a patient comes in. You want to discount the patient. How much are you going to discount the patient? How much are you allowed to discount the patient? Have you checked into it? Most of the doctors that I speak to, they go, oh, yeah, well, we do this. Really, what do you do? Well, we just tell patients, just give us $30 a visit. That's enough. We don't want to burden the patient, Where'd you learn that? I don't know. Our friends do it, Oh, we don't do, we discount 60%. When new patients come in, we discount, our normal fee is $100. We tell the patient 60% discount. They just have to pay $40 for the exam, cash discount. Really? Where'd you learn that? I don't know. Friends do. So how much can you discount? Your normal fee is $100. Here comes a patient. You want to give the patient a break because they don't have insurance or they have a huge deductible. You want to give them a discount. How much can you discount? You should check with your state board. Now, have you checked with your state board? Have you checked with insurance companies? I've done some checking. You know what the answer is? I have information right here. It's right from the federal government, 15%. So, Mrs. Jones, oh, you're a Medicare patient? Well, our normal fee is $100. Oh, you don't, you want, well, your insurance doesn't pay for the exam, so it's 85 instead of 100. That would be okay. Medicare allows that. What about free services? Patient wants to come in, want to offer a free service? Are you allowed? What's the value? How much, your exam is $200. I saw one ad, chiropractors advertising, free exam, free x-rays, and the first 3 adjustments, value $700 something. All free for, free. Is that okay? Have you checked? What can you, Dr. Kotler, yeah, I did a little surprise visit to one of my clients just to say hi. I walk into his office. In his waiting room, he has a mountain bike, a brand new, beautiful mountain bike hanging from his ceiling. And he has a little contest going. The patients that refer the most new patients, the one patient that refers the most new patients in the next month is going to win this bike. Value $1,200. $1,200 mountain bike. Is that okay? Can you give a patient for referring other patients a $1,200 mountain bike? Well, is this a cash patient that won the prize? Is it a Blue Cross Blue Shield patient? Is it a PI patient that won the bike? What about if it's a Medicare patient? Can you give a Medicare patient a $1,200 bike? Can you give a Medicare patient a free exam worth $100? Well, this is it. $15 per item, $75 total for the year. That's it for federally funded patients. Careful. Look at this chiropractor. He was giving away free stim. He got caught by the U.S. Attorney's Office in the state of Iowa. They came in, they fined him $79,919 because he was giving free stim to his Medicare patients and billing Medicare for chiropractic adjustments. You know what they said? You're inducing patients. I don't think I don't know this doctor. I don't know what happened, but I doubt highly he was giving away the free stim to induce the patients. But that's the way Medicare looked at it, and they fined him $79,919. One of the things, when I read things like this, I have tons of stories like this, but when I read them, I'm like, how did they find out he was giving away free stim? How did they find out? A disgruntled employee reported him, an unhappy patient. maybe a jealous doctor down the street. Careful, don't give away free services in general. Now that we're talking a little bit about Medicare, all right, here we go. I have a little Q&A. Can you treat Medicare patients without submitting claims to Medicare? The answer is no. Can you treat Medicare patients without being enrolled? No. Can chiropractors opt out of Medicare? No. Can you collect cash from Medicare patients without billing Medicare? Maybe. If the patient checks option 2 for maintenance care on the ABN form, yeah. So now this is one of the items where a lot of doctors and staff members, they go, what? I've never heard this before. My coding consultant never told me this. I go to my state conventions every year. Nobody's ever mentioned this. Yeah, I know. Yes, I know. You've never heard this before. Chiropractors cannot opt. Some chiropractors do this. They're not enrolled. They're not billing Medicare. They just tell Medicare patients, oh, we're non-par. We don't bill Medicare. Just pay us cash. Just fill out the ABN form. No, you cannot do that. No, no, no. That's illegal. Actually, Medicare says, the ABN form, that's our form. Medicare owns the ABN form. If you're not enrolled in the Medicare program, you're not allowed to use the form. What? What did you say, Dr. Kotler? Yes, there's the source. There's the link. This is right from Medicare. It says Doctors of Chiropractic in the bottom right corner. Doctors of Chiropractic may not opt out of Medicare. This is right from Medicare. Noting that opting out and being non-par are not the same things. Chiropractors may decide to be par or non-par, but they may not opt out. So stop treating Medicare patients if you are not submitting claims to Medicare. The first bullet, see what it says? Stop treating Medicare patients if you are not submitting claims to Medicare. Do not confuse non-par with opt-out. Third bullet down, stop treating Medicare patients if you're not enrolled in Medicare. So if you haven't billed Medicare in a year, your claim, your status is in a holding pattern. Get revalidated and then see Medicare patients. At the present time, you need to stop. If you want to treat Medicare patients, you have to submit the claims. You can't just say, hey, Mrs. Jones, come on in. Now, this is for chiropractic services. In an integrated practice, your medical doctor can opt out. Your medical doctor can opt out, and you could have cash, full cash fee for all services, and you don't even have to bill Medicare. Chiropractors can't do that. So if you want to treat Medicare patients as a chiropractor, you must be submitting the claims. If you're not submitting the claims, you don't want to submit the claims. You don't want to be involved with Medicare. Yes, I hear that all the time. Stop seeing the patients. Look at the last bullet. If you do not want to submit claims to Medicare, refer the patient to another chiropractor that is enrolled in Medicare. When I bring this slide up at my seminars, everything stops. 90% of the audience seem confused. Check into it, look into it, start making changes, and do the right thing. Next, with HIPAA, just a little bit about HIPAA. 99% of you have to abide by HIPAA because you're considered a covered entity. Why are you considered a covered entity? Because you probably bill and receive payment from insurance companies. If you submit claims electronically, you are a HIPAA covered entity, which means you are supposed to abide by all the HIPAA laws and rules. Can you have sign-in sheets? Yes or no? Can you email patients? Yes or no? These are all the things that you need to be aware of when it comes to HIPAA, the basics. Antivirus software, do you have that? It's required by HIPAA. Forms, notice of privacy practices needs to be given to every new patient. Patient wants to have their records transferred to another provider. There is specific authorization to release information forms. We have all these forms, by the way, if you're looking for a packet of forms. So now, if you want to get started with HIPAA and you can't afford hiring an outside company, go to this website. It's a great way to start. Start trying to do it on your own. If you can't figure it out, then contact us. You have to do a security risk assessment. It's one of the first things. If you ever get pulled over by the HIPAA police, one of the first questions they'll ask is, could we see your security risk assessment? So start doing that. Here's a place, this website. You could start doing it on your own. All right, just a few closing comments here. I like to close with my 9-step action plan. Step 1, get proactive. Start doing things that prevent problems. Like, don't wait for the oil light to flash on your dashboard. Get out of the car, open the hood, check the oil. Staff members, step 2, make sure all the new patient forms get completely filled out by the patient. I've seen that be an issue. Right now, doctor prescribed a TENS machine on a patient. TENS machines is a chronic problem. It's got to be at least 3 months. So patient comes in, doesn't write down how long the problem started. The doctor didn't write down when the problem started. Now the insurance company wants the money back. See, make sure all the forms are filled out. Doctors, number 3, review all the paperwork before you go into the room and start dealing with the patient. Step 4, review the policies from the insurance companies you bill. A lot of the information as to what they want from a medical necessity standpoint is right in the policy. Step 5, understand the what and the why. Your CPT codes or what you're doing. Your diagnosis codes or why you're doing them. I call this code pairing. How many of you ever been to a wine and food festival? I love going to them. I like learning from the masters that teach me how to combine wine with food for that maximum culinary experience. There's people out there that know how to do this. So I've taken it to a coding level. I'll pair your diagnosis codes and CPT codes. Like, for example, cervical radiculopathy pairs beautifully with mechanical traction. Patient has myofascial pain in the cervical region. Well, that pairs beautifully with manual therapy, right? So these wine and food festivals, there are people there called sommeliers. I think I'm pronouncing, it's a French term, wine and food pairing expert. I consider myself a coding sommelier. I will pair your codes for you. I've done this in a book. I have a book of code pairing. Shows you, here, you want to do therapeutic exercises on a patient? Pairs beautifully with shoulder stiffness from Napa Valley. All right. Next, step 6, do a self-test on your SOAP notes. Again, that's being proactive. Step 7, keep attending webinars, keep attending seminars, sign up for my newsletter, go to your state association convention at least one a year, attend a target coding seminar at least one a year. Always keep learning how to help more patients and improve your business. Another good thing, put together a billing and coding policy manual. We train our doctors how to put one together just in case the HIPAA police come knocking on your door, the coding police come knocking on your door, you have a disgruntled staff member that reports you to an insurance company. Oh, you have your playbook. You have it all done. We do that for doctors. We charge $7.95. It's a simple billing and coding policy manual with 18 policies and procedures customized for your practice. 9, have regular meetings, especially with your staff members that are doing your billing. Do you use a billing company? Do a spot check on them. I'm working with 2 doctors right now. They're being audited because their billing company messed up. Their billing company was adding modifiers, changing the codes. Doctors getting audited didn't even know why until got the audit letter. You want to do all these things so you could SWAN. You've heard of that acronym? SWAN? It's my favorite one. SWAN. It means sleep well at night. Check with all the carriers, please. Make sure it's compliant. I want to thank everybody for attending. Here's my contact information. There's my email. You could email me directly. Again, we offer free consultations. You want to just pick my brain. You want to find out if we could help you. I hope you learned a lot today. We're going to get to questions and answers in a minute. Just a couple other things besides these webinars. We do seminars all over the country. Most of them are approved for CE credits. This is a book that I recommend every chiropractic practice in the country have as part of their library. It doesn't replace the AMA CPT code book. It doesn't replace Chiro Code or any other books. It's a guidebook. It tells you how to bill to make the most money. It shows you how to code pair. It shows you which visits pay for the most, which codes pay for the most visits. What pays more, sciatica or muscle spasm? It's in the book. What's the difference between spasm and contracture? It's in the book. Cheat sheets. FAQs. You could be in practice for 30 years. You might not know the difference between cervical brachial and cervical radiculitis. You might not know the difference between idiopathic scoliosis and thoracogenic scoliosis. What's the difference between myalgia, myositis, myofasciitis? I put together a whole bunch of FAQs. All the things that I wanted to know when I first started practicing are in the book. My first 6-7 years in practice, I didn't know what I was doing. I was losing money. I was giving away so many things for free. I wish I had this book. So what I did was I took all the things that I knew I wanted to know when I first started practicing, and I put it in this book. How to pair it. Do you bill for therapeutic exercises? Wouldn't it be a good idea to know which diagnosis codes pair and what is the clinical rationale? It's in the book. Oh, I mentioned my forms. Here are my forms. This is my forms packet. 75 forms, and we broke them down into new patient forms, financial and admin forms, exams and treatment plan forms, a whole bunch of sample soap notes. They come to you. We'll email them to you instantly. Today, if you order these forms, we could email them to you. They're all in Microsoft Word. You open it up. You go to the top of the form. It says Main Street Health and Wellness. You highlight that. You delete it. You put your name and address on the top of all these forms. Customize them. Whole bunch of letters of medical necessity. Recently, a client of mine said, Dr. Kotler, a patient of mine needs a letter of medical necessity for one of those stand-up desks, those Vara desks. I put one together. I sent it to him. Insurance paid. Like, oh, that's a pretty good letter. I added it into the forms pack. Whole bunch of letters of medical necessity for decompression and laser and taping and back braces and TENS machines. Fight back letters. A bunch of those. PT forms, acupuncture forms, Medicare forms, HIPAA forms. We also provide doctors with compliance manuals, Medicare, HIPAA. If you see Medicare patients, you're supposed to have a Medicare compliance plan. You bill insurance companies, you have to have a HIPAA compliance plan. We also offer memberships. We have our base membership. It's $99, pay as you go. Unlimited questions and answers. You get live webinars. Many of our webinars, we do webinars just about every week. Many of them, there's a fee. This one was free. Many of them, there's a fee. We have one coming up next week on chiropractic treatment plans. There's a fee for that. If you're a member, you don't have to pay. It's nice. Want to put together just a basic, simple billing and coding policy manual to protect you. We train you, the doctor, to protect yourself from disgruntled employees. It happens a lot. You'd be shocked how many offices we're dealing with right now where we have associate chiropractors and billing staff members and CAs that quit abruptly and they report the doctor to the state board. You need to have a billing and coding policy manual to prevent those things from happening. We have 11 videos on our website that we sell. 11 videos on all different topics. There they are. So again, I want to thank everybody for attending. Let's go and take a look and see what questions have come in.